is not here today. And Sheila asked me to be at her birth for sibling doula support. She had a toddler, she had nobody to watch him, and she needed somebody to be there for him. Interestingly enough, surprise, surprise, at 1:30 in the morning, her son Connor wanted nothing to do with me. And so in the parking lot, Kevin and I, her husband, we swapped spots. I wound up getting Sheila upstairs. I got her into her labor and delivery room. We got her onto the toilet because the nurse said she had to have a urine sample. And next thing we knew, I was literally delivering her baby. And the nurse and the midwife made it into the room to catch the feet. It has snowballed from there without a whole lot of intent, so bear with me. Today we have 25 team members. We've been in existence for 25 years. We've worked with over 5,000 families. We have over 200 5-star reviews, and we've been winning awards right and left since 2017. A little bit, I know there's been a lot of conversation about what do I do and what do I not do. So we're going to talk a little bit about birth doulas, postpartum doulas, advantages of having a doula. I'm going to tell you 2 more easy stories, and then we're going to talk about what makes a good referral. Probably the most important thing you guys need to know is that the healthcare system is broken. It is actually a sick care system, and these numbers are going to prove it to you. 96% of the time you are in labor, you will be alone. Whether you're at a hospital, a birth center, or a home, it does not matter. Within those numbers, our U.S. cesarean rate is 34%, and the World Health Organization actually recommends that the world C-section rate is between 10 and 15%. That means in the U.S., we are triple that rate. Hand in hand with that, 31% of everybody who gives birth has some sort of a birth complication, and those complications are driving up healthcare costs. You guys have heard about that from other speakers. And then last thing you should probably know is that if you are in a high-risk demographic, your increased risk of death is 3 to 4 times over a healthy white woman. Childbirth is supposed to be one of the best times in your life. I just told you it's not. However, why? What is it that's got people all worked up? And first and foremost, that comes down to fear. We have been looking at the newspaper, we've been following mass media. We know that our lives are at risk in the labor and delivery room. We are lacking the knowledge and the skills that we need to make choices. We are afraid of being neglected, overlooked, and marginalized. And on top of that, we're afraid we're going to wind up in the obituaries. So a lot of families are choosing to hire a doula, and this is the actual definition of a doula, and the easiest way for me to explain that to you is we are a bridge between the parents' wishes and desires and the safety of modern medicine. We help families get from one end to the other, and we do that with a continuous presence that offers physical, mental, emotional, and informational support. We work in hospitals, birth centers, and home births. So everywhere, and we have teams locally here in Phoenix, and I have 2 of my Phoenix members here with us. We also have teams in Maryland, DC, and Northern Virginia. We also offer virtual and in-person services nationally and internationally, and we have worked in 6 different countries outside the United States. Who do we serve? Number 1 is you guys. Business owners, school teachers, policemen, the military, that is our bread and butter. But we also work a lot with medical and legal professionals because they understand their risks very differently than people who work outside of the hospital or the medical system. And then of course we have a large percentage of public figures, think Olympians, sports figures, Emmy winners, TV personalities, etc., that cannot be down for a long recovery period, and so they hire a doula to make sure that they get up and out of there as fast as possible. I have stats and science for all of this, so for you science people, I can substantiate all of this, but for everybody else, doulas have been proven to reduce your C-section rate, increase the likelihood of having a spontaneous birth, reduce mental health concerns and impacts both prenatally and postpartum, shorter labor times, reduce needs for pain medication or better timing of your pain medication, and overall improved birth satisfaction and bonding with your child. In lay people language, that means reduce stress, shorter hospital stays, shorter recovery times, fewer complications, fewer preterm births, shorter, better postpartum outcomes, and less postpartum depression and postpartum anxiety and post-traumatic stress syndrome. Told you 2 more stories, so here's the next one. This is Jean. Jean hired me in 2017 because she hated being pregnant. Her husband was in medical school, sorry Brian. Her husband was in medical school and she wasn't guaranteed that he was gonna be able to get out because he was on call to get to the birth. So she hired me to be there for the birth. It was a longer birth, she wound up having an epidural. She had a live baby. When it was all said and done, she goes, we're done. Never gonna do that again. I know Brian wants another kid, but yeah, no. 2019, guess who calls me? She's pregnant again. We wind up having another great birth, and she hired me because her husband slept through the first birth because he was exhausted, and she wanted to make sure she had somebody at her side. So we had baby girl number 2. 2021, she's back. And Jean goes, Ursula, honest to God, we're never doing this again, but I couldn't do it without you. We had baby girl number 3. She goes, we're scheduling the vasectomy. 2022 came. Baby girl number 4 arrived, and he got snipped. Postpartum doulas. Postpartum doulas improve your mental health. They help you with breastfeeding, bottle feeding, pumping, all the nuances of raising your child. We teach you all the infant skills you need, and we help to facilitate your bonding process. We help to teach you the skills that you need and to give you the confidence in learning your baby's cues and how to respond to them. We also help to reduce hospital readmissions, and we can give you all the resources and the help that you would need. Again, what does that mean? Reduced stress, shorter recoveries and hospital stays, fewer readmissions. By the way, statistically, if you have a doula at your birth, your child will have 5 fewer hospitalizations over their lifetime. Interesting side note. Fewer preterm births, you saw that before, better postpartum outcomes, and probably most importantly, reducing any type of trauma that could happen. This is Asa. I intentionally put the story in here for shock value. What we did for Asa was a little different. Asa was a surprise. We did not know that he was going to be born with an extremely rare genetic syndrome called Fraser syndrome. There are only 50 cases in all of US history with this syndrome. When he was born, we knew he was different. Obviously, you can look at that, right? He's blind, he's a level 3 autistic, and he has a whole bunch of other health concerns. What we did with them postpartum is we helped her with bonding and breastfeeding, we helped her with meal prep, we helped her with her toddler. But the most important thing that we did is we helped the family to deliver and find the language to deal with people when they looked and pointed when she took them in public. And then every time we went, we took him out in public into a slightly further place, and we started uncovering him and helping them to feel comfortable with his presence. He is now an extremely healthy 11-year-old boy, and he is doing great, but unexpected things can happen even in the best situations. We also offer classes, workshops, consultations, and trainings. Keywords for